Om Swastiastu. Hello everyone, we are from SGD 6 and in this occasion, we would like to present our student project entitled Subcutaneous Mycosis, Rhinosporidiosis, Lobomycosis, and Zygomycosis. Here are our team members. We'll start by presenting the first chapter of our topic, Introduction. The first one is background. Mycosis, often known as fungal infections, is a disease caused by fungus. Annually, more than 150 million severe cases of mycosis occur worldwide, resulting in approximately 1.7 million deaths. Fungal infections are increasingly becoming a global health threat, with high morbidity and mortality rates, as well as terrible socio-economic repercussions, thus needing rapid and innovative action on many levels. One type of mycosis, subcutaneous mycosis, is a group of infections caused by the fungi present in the natural environment that infect the dermis and subcutaneous tissue via traumatic injury from vegetative materials. Subcutaneous mycosis is a rare disease, thus it remains neglected and is still not recognized as a severe healthcare issue. In this topic, we will focus on the general overview of subcutaneous mycosis and the three types of it, namely Rhinosporidiosis, Lobomycosis, and Zygomycosis, as well as how to diagnose and treat them, thereby raising awareness of these infections both locally and globally.
And the next is problem identification. First, what is subcutaneous mycosis? Second, what is rhinosporidiosis and how is it diagnosed and treated? Third, what is lobomycosis and how is it diagnosed and treated? And fourth, what is zygomycosis and how is it diagnosed and treated? And then the purpose of this student project is to understand more about subcutaneous mycosis and then to know how to diagnose and treat rhinosporidiosis and to know how to diagnose and treat lobomycosis, and the last is to know how to diagnose and treat zygomycosis.
The significance is to provide a sufficient understanding of subcutaneous mycosis, including its various subtypes, as well as how to diagnose and treat them. Next, it is as a source of reference and input for further research.
In the next part of the presentation, we are going to talk about Chapter 2, Literature Review. In the first part of the literature review, we are going to talk about the general overview of subcutaneous mycosis. It is an infection of the dermis or subcutaneous tissue caused by fungi present in the natural environment that can enter the skin through penetrating injury from vegetative materials. It mainly affects people who live in humid tropical or subtropical areas, and it is most commonly found in adult males that often come in contact with soil and vegetation, such as farmers. And they are characterized with the presence of benign lesions such as localized swellings. But they can often be mistaken for other benign lesions such as lymphoma, hemangioma, or abscess. The main diagnostic method for subcutaneous mycosis is histopathology examination. For the classification, it can be divided into 6 different types, which are sporotrichosis, mycetoma, chromoblastomycosis, zygomycosis, rhinosporidiosis, and lobomycosis. But in our project, we are going to be focusing on discussing 3 main types, which are zygomycosis, rhinosporidiosis, and also lobomycosis. Zygomycosis is caused by molds that live throughout the environment, called mucormycetes, and it is transmitted from inhaling fungal spores in the air, which can affect the lungs or the sinuses. Rhinosporidiosis is caused by the fungus Rhinosporidium seabury and is acquired by bathing in ponds contaminated by animal feces. Lastly, lobomycosis is caused by the fungus Lacazia loboi, and it is characterized by lesions in exposed areas such as the auricles and the upper and lower limbs.
So the first subcutaneous mycosis we are going to discuss here is rhinosporidiosis. First of all, what is it? It is a chronic granulomatous disease caused by Rhinosporidium cerebri, which affects mucosal surfaces. So what are the symptoms and the characteristics? So the primary symptom of rhinosporidiosis is the development of polypoidal, reddish, friable, pedunculated, and hyperplastic soft tissue masses in the nasal, which normally progresses slowly and chronically. So polyploid tumor-like masses around or in mucosal areas such as the nasal, oral, vaginal, etc. is therefore the hallmark, is therefore the characteristic or the symptoms of rhinosporidiosis. So the mode of transmission of Rhinosporidium cerebri is actually not fully understood yet, although it has been presumed that the mode of transmission is from transepithelial infection. So the infectious form of Rhinosporidium cerebri is actually the free endospores, which could enter our body from injured epithelium.
And now we will discuss about the diagnosis of rhinosporidiosis. Imaging contrast intensity plays a crucial role in identifying the location and severity of rhinosporidiosis, as well as excluding the involvement of the nearby bone, the nasolacrimal duct, and the tracheobronchial tree. Cytology may also be useful in some low-income regions, particularly in extranasal lesions. The definitive diagnosis of rhinosporidiosis is based on the clinical presentation, microscopy, and histopathological examination with fungal stains such as periodic ashes shift, gomarimetanamine silver, or HNE, hematoxylin, and eosin.
Now, in order to treat rhinosporidiosis, a surgical procedure must be done. It is the most used, the most suitable, and curative treatment with a 90% success rate. To control the spread of this disease, however, it is multi-drug therapy. Study shows that a combination of cycloserine, dapsone, and ketoconazole shows promising results and can be used for therapy.
The second type of subcutaneous mycosis that will be discussed further is lobomycosis. Lobomycosis, also known as colloidal blastomycosis, is a chronic fungal infection caused by Lachesia loboi, an uncultured fungus found in the Amazon basin. This mycosis is first discovered in Brazil, 1931 by George Lobo. As I have mentioned before, Lachesia loboi is known to only be endemic on the South America. The long incubation period of this fungus to develop and show symptoms makes it even more difficult to diagnose and identify the cause of infection. It may require years for the symptoms to start appearing. For this reason as well, this type of mycosis is even less to be reported. It is known that from 1965 to 2019, there are only 550 cases being reported. Lobomycosis, as its other name implies, shows its most distinct characteristic that is manifested on the skin, which is the wart-like, ulcerated, and keloid-like lesion. It will give off smooth and shiny appearance on the skin. Furthermore, papules and nodules are also reported to appear in lower limbs and ears for several cases.
The diagnosis of lobomycosis can be seen by observing the clinical aspects of the lesion, where there can be found a birefringent membrane around an oval yeast-like structure with a size between 6 to 12 micrometers in the dermis. The fungal structures may be found isolated or with a simple gemellation. And visualizing the fungus can be done simply by taking a sample by scraping or using vinyl adhesive tape or exfoliative cytology. There are also an increase in the numbers of macrophages or histiocytes of the dermis, and sometimes the una bound may be found.
Next is the treatment. The most suitable treatment for lobomycosis is surgical treatment to remove the severe keloids of the subcutaneous mycosis before it spreads throughout the body. And then the second is the use of itraconazole. This drug can be used as adjuvant to suppress recurrence of surgically removed lesions. And then the third is the combinations of antibiotics such as rifampicin, dapsone, and clofazimine to reduce of mycotic nodules in patients with leprosy and lobomycosis co-infections.
Next is the general overview of zygomycosis. So zygomycosis is a group of fungal infections caused by fungus belonging to the class Zygomycota. Due to ischemia, vascular thrombosis, and tissue infarction, the condition of rhinocerebral zygomycosis quickly advances to bloody discharge and necrotic areas that might reach the brain tissue. The third most prevalent invasive fungal infection behind aspergillosis and candidiasis is zygomycosis. In 1956, Indonesia was where the first case of subcutaneous zygomycosis was discovered.
Right, so the next one is making the diagnosis for mucormycosis. So making the diagnosis for this disease is considered hard due to the nature of fungal infection, which is many diseases will share the same symptoms. But there are a few hallmark or some kind of things you can look for in mucormycosis. So first of all is tissue necrosis. Tissue necrosis is the hallmark of the disease, And even though it shares similarities with Aspergillus and Fusarium-caused infection, it is still considered one of the hallmarks for mucormycosis. And secondly is the reverse halo sign on the RHS, which is shown on the CT or X-ray scan. This is one of the things that you need to look for in mucormycosis infection. And the gold standard for this infection, to diagnose this infection, is the microscopic examination, in which you will be able to differentiate between one agent of infection, say an Aspergillus, and also a mucormycosis. And this is still, till this day, considered as the most important thing to do when diagnosing something with mucormycosis. Thank you. Okay, so on this slide, you can see the diagnostic pathway for mucormycosis. On the top part, you can see there are multiple scans being conducted. One of the most common signs we're looking for is known as the reverse halo sign, or the RHS, which is one of that is the most common sign of mucormycosis. And on the bottom part, you can see there are multiple examination that is more specific, such as the diode microscopy with fluorescent brightener. You can also see the culture examination and also the molecular identification taking part on the bottom of the diagram right there. This is indeed to make sure that the infection is really a mucormycosis and not something caused by another fungal infection agents, such as the Aspergillus or the another fungal agents. Thank you.
After the diagnosis is made, treatment is needed as soon as possible. The first treatment is with antifungal medicine. We can use liposomal amphotericin B as the first-line therapy, which will administered intravenously. The second treatment is by surgery. It is frequently necessary to remove the affected tissue.
Lastly, to conclude our student project presentation, first, subcutaneous mycosis is still overlooked, although its case number is increasing. There are three main types of subcutaneous mycosis mainly discussed, which are Rhinosporidiosis, Lobomycosis, and Zygomycosis. Each of them varies on how they affect our body parts. For instance, Rhinosporidiosis has soft tissue mass appearing from our nasal or oral vagina. Lobomycosis has nodules appearing on the limbs and ears, which appears years after the trauma, while zygomycosis also varies. For instance, it mainly affects our nasal, and there's also sinusitis, and there's also lumps on arms and our legs. And we can conclude that the histopathology and CT scan are the most common ways to diagnose subcutaneous mycosis. Surgery and medicine are the most common ways to treat subcutaneous mycosis. So that is all from SGD Basics. Thank you for your time and attention. Om Santi 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 Om.